Glaucoma therapy involves lowering the eye pressure, and this is to protect the optic nerve and prevent blindness. And this can be done with eye drops, laser, or surgery. Eye drops is a very safe way of doing this, and it's often the first-line therapy we have for lowering the eye pressure. There are 4 main families of eye drops that we use. There's the prostaglandin analogs, the beta blockers, the carbonic anhydrase inhibitors, and the alpha agonists. The eye drops need to be used on time, every day, all the time. So it can be difficult to remember to use your eye drops. So simple tips like setting your alarm on your phone or putting the drop by your bedside table to remind you to use it at nighttime can be very helpful in reminding you to use the eye drops. Common side effects for these eye drops are redness and irritation, although they tend to get better over time, so don't give up within the first week. It's important when you put the drops in to wipe it away straight away and not to leave it to linger on the eye too long, otherwise sometimes it makes the side effects worse. So remember, the purpose of the eye drops is to lower the eye pressure and prevent progression of the glaucoma and prevent vision loss. So if you stop using the eye drops, they're not going to be effective anymore and the eye pressure goes back up and you're putting yourself at risk of vision loss. There are many reasons why people are not able to use their eye drops. Sometimes it's technique, sometimes it's costs, sometimes it's the side effect profile of the medication themselves, or sometimes they're just not used to using these eye drops. It's important that you speak to your eye doctor to be able to discuss these problems and to try to come up with a better treatment plan for you. Another alternative to eye drops is to perform a simple laser called selective laser trabeculoplasty. The advantage of this laser is that it's more convenient. Once the laser is applied, it can last 2, 3, 4, 5 years without having to use eye drops, and it can be very effective as one medication, and is often a first-line therapy as well in people who struggle with eye drops.